Hey, I was just wanted to create a video here to document a bit the process, my experience of getting a PRP injection in my quadricep tendon based on a quadricep tendinosis that I've been dealing with here for the past 5 months. So, um, I did a little bit of my own research as I'm actually gearing up to get this procedure done in about a week. I've did a bunch of research on my own as far as what is PRP, how is it used, is it effective, and there's a bunch of scientific literature publishings on potential effectiveness and all this stuff, but maybe not a lot of YouTube content so far, and at least not on this specific thing that I'm dealing with. So figured it'd be relevant, for me to create a video here, maybe help some other folks out. So as far as a little bit of background on myself goes, so my primary sport and the cause of this injury is cycling, and so for the last 2.5 years or so, I've been pretty focused on that as a maybe like the single activity that I use to get some exercise. So potentially that's why this problem has come about, in the first place, because I've not done a lot of cross training, right? So I look at fall of 2019, bought a new bike. Winter of 2020, January 2020, got a smart trainer, doing like the whole Zwift thing. And then since then, which has been 2 years since then, did a big combination of kind of indoor riding, outdoor riding, indoor training, that type of thing. Primarily gravel riding, and then some mountain biking as well. So I'm located here in the Pacific Northwest. I was just looking up my stats as far as how much I rode in this last year. So for 2021, I rode for just over 3,000 miles and 130,000 feet in elevation. So for those familiar with Zwift, I did a lot of Alp to Zwift, trying to get unlocking the Tron bike successfully. And I think of note as far as this, the mileage that I put in for the month or the year of 2021. Things tapered off big time in September, which is maybe 5 months ago, because of this injury that I got, right? And so yeah, that's kind of how active I am. Obviously, I'm not like elite. I'm not placing in competitions or anything like that, but I have participated in some organized events and all that. So um, I'm also 37 years old, and so just to give some insight, I'm not a spring chicken anymore. And I think this injury is a bit of a realization for that as well. So yeah, so that's I like to bike, love to exercise. That's about how much I've done it in the last year or so, or a couple of years. As far as this injury goes, if I look back of spring 2020, right? So maybe 6 months or so of really being, less than 6 months of really being into loving being on a bike. A buddy of mine and I went on a bike packing trip, and so this was maybe 150 miles. One night, going from Snoqualmie, Washington, over to the eastern side of the Cascades, doing a Tacoma and Stampede Pass loop, and then coming back. So 150 miles or so, maybe 7,000 feet of elevation. And the days after that, I got some good knee pain on both my knees, actually. So top dead center of the kneecap, anytime going up and down stairs, hurt. Anytime trying to pedal on the bike, hurt. So I was doing like the classic rest, ice, compress, elevate. And after a couple weeks time, things got better. After that, I got a professional bike fit from a bike fitter slash sports physical therapist, and things had been better since. So I'd actually participated then in some events, like including a 65-mile 10,000 foot gravel ride. I don't even know, 7-8 hours on the bike, something like that, and no kind of, didn't have that same type of knee pain. Fast forward to this last summer, so summer of 2020. I was mostly cycling, just kind of from home, right? And it was like, hey, I got an hour or two to burn, and I just want to go get some exercise. So I do kind of like these sprint efforts, like I'm just going to go dust the cobwebs off. But that was, my focus was just, I'm getting in, the time that I can on the bike, getting in the exercise. And then a few months later, I ended up going on what I consider a big gravel ride, and that was 75 miles, 7,000 feet elevation. Again, 7-ish hours in the saddle, and On that ride, maybe 2/3 of the way through, my right knee started to hurt. So every pedal stroke, at the beginning it was like, oh, that's a little uncomfortable. And then, the last 2 hours, the last hour, the last 30 minutes, the pain was increasing every pedal stroke. And, by the time I was done with the ride, even like the last 45 minutes or so, it was like excruciating every pedal stroke. And it's a circumstance where you're away from your starting point and you have no other way to get back. So you got to pedal to get back. So that was super painful. I figured I'd do the same rice kind of approach. And a stupid move on my part was then maybe 2.5 weeks later, I did another long ride. And this was because my family and I had a trip planned to Maui. And there's this West Maui loop that's, I think 40 or 60 miles and 4,500 feet of elevation. And it's like epic single lane road, ocean views, tropical, you're getting rained on one minute, you're getting sunshine the next. So I just was like, well, I'm going to rest up. I'm going to take a bunch of anti-inflammatories. And I'm going to do the ride. And that was a mistake. And so my knee pretty much hurt the whole time. It was not enjoyable. And the rice approach did not solve the issue. So I went to my primary care provider. He originally said, oh, you have runner's knee. It looks like you have a knee tracking issue. It's your kneecap isn't tracking inside the groove and you need to get physical therapy. So I went back to my physical therapist, the bike fitter, told him my diagnosis, and he did his own kind of assessment and said, well, based on where your pain is occurring, which again was right knee only, top dead center, he's able to press above the kneecap, press down on it, and generate some pain, some discomfort for me. He said, oh, this looks like tendinosis, or maybe at the time tendinitis versus now tendinosis type issue. Not a alignment, kneecap alignment type issue. So he gave me some PT exercises to do, and these were things like one-legged mini squats and one-legged balancing exercises, one-legged jumping up and down from a real short or kind of platform, step up, step down. Doing some friction massage, so kind of left and right, gently across the top of my quadricep tendon there, and then slowly ramping back up on use on the bike, right? So it's like do the easiest recovery rides you can, start out short duration, try and get up to an hour. And so I was doing that and have been doing that, but we're 3, 4, 5 months later. 5 months later since the original injury, and maybe 3 months past when the PT really started. And I would say my knee's maybe 80% better, but the problem still exists, right? So anytime I really try and put power through my knee, it still hurts or is uncomfortable and then progresses to hurt. Even now when I ride my bike, I would say the first 15, 20 minutes, especially when starting out on a ride, my knee feels awfully stiff and it becomes maybe more comfortable, but it's not great, right? And so in talking to my PT guy, he says that these tendon issues can take a long time to heal. I will disclose, right, that I'm probably not an exemplary student, in that, if student is the right word, but the exemplary as far as following the guidance, right? So, stating, hey, avoid the pain, keep it to recovery rides all the time. I will really struggle to not want to just kind of put a little bit of power down, because that's what I enjoy about the sport, and that's what helps me feel better. And so, I've probably done some things over the course of these last 3-4 months to lengthen the progression or towards recovery, or progress towards recovery, right? So that's just a little bit of an FYI. So PRP, right, was suggested by my PT guy, had a referral to a specialist, a doctor. So his private practice, I think he's formally trained, or his specialties in like rehabilitation, also sports medicine, I think, as well. So PRP is what he does. I've done a bunch of research. It's not covered by insurance, right? So I'm going to be paying about $900 out of pocket. Not really excited about that. But I think that is kind of based on, this is a little bit emerging, at least in the States, what I've read, and I'm not an expert on this, it's like within the last 10-15 years is when this has become a little bit more common, and you hear about it mostly or maybe the what you would read about this or hear about this would be for professional athletes, that have gotten a PRP injection or two or something, to help with some sort of joint type issue. And so from what I understand, this can only aid in helping speed up your recovery time frame and help with the healing process. So when I went in and got a consultation from the specialist, he did a ultrasound of my knee, kind of all around the knee, but looking at the quadricep tendon, he was able to find a tear in it and identify a tear there, and stated, this is kind of what PRP is for, and would help expedite the healing process, right? So as I understand it, PRP, right, it's a blood draw. They put it in a centrifuge. They separate out your platelets, and then you're essentially just putting your own stuff back in your body in a concentrated form in a specific location, right? So the worst that can happen, I don't know. I'm not a professional, but it seems like from what I've read that it would be hard to make things worse, versus this is an opportunity to make things better quicker, right? And so through the consult, I was able to get some documentation on the recovery process, and this was a bit of an eye-opener for me in that it's not like a cortisone shot where it's like, football linemen's like, put me back in, coach, I want to play. You get a cortisone injection, and you're back on the field because the inflammation's down and you're feeling better, whatever. This is like, once you get the PRP done, you have to limit use and range of motion of that location for a period of time. So the guidance I got is, hey, you need to be on crutches, no weight bearing for 5 to 7 days, and then slowly progress from there. So partial weight bearing, begin to introduce range of motion, over the next weeks thereafter. Get yourself on a exercise bike, a spin bike, use your other leg to spin the pedals while the leg where the PRP injection occurred is just kind of following the lead there to begin to reintroduce range of motion. So recovery time is actually looking at, from what I've read online, so with the guidance that the doc provided to me, it ranges between 4 to 6 weeks to 8 to 12 weeks, which is not something I'm looking forward to, but if it's going to help, then I'm going to do it, right? I think that's kind of where I'm at, as it's been so long. It doesn't seem to be getting better. So let's try something new, right? And see how it goes. So the intent of this moving forward is going to be to document the procedure and the recovery thereafter, just so folks kind of have a better understanding of what it looks like and what it feels like. I think, one of the interesting things I read and learned about this whole PRP injection, and part of the prep for it, is they tell you not to take any anti-inflammatories for a period of time beforehand and a period of time after, and that the PRP injection actually generates an inflammation response. So there's got to be some sort of correlation between that inflammation and some sort of healing process. But I imagine if there's a whole bunch of inflammation that's occurring in my knee, that's not going to feel super good for however long that's happening for. So obviously, a little bit of nerves as far as like, hey, getting a procedure done. Obviously, this isn't like I'm going under and getting some surgery done or anything like that. This seems to be the way it's communicated, or the way that it's communicated, is that it's supposed to be, an option instead of something as invasive as surgery. This can be something that can make you feel better without the severity of going under the knife type thing. So we'll see, and hopefully there'll be some follow-up videos here, and people can see maybe how painful it is, what the recovery process and timeline looks like, and whether or not it's worth it, right? I think that's what I'm looking at is whether it's going to be worth it. I've got some ambitious goals of some bike rides I want to do later this spring and summer, and I question how realistic that is based on the recovery timeline, and then how long I'm going to be out and have to recover, and then have to train and get some fitness thereafter before spring and summertime, right? Which is just around the corner. So it's early February right now. So yeah, that's my vid, and we'll see how things go. Thanks.